So looking at the cardiovascular risk factors, and of course, many of you would have heard from talk shows, from internets, and of course from public talk, you know, high cholesterol, high sugar, which is in terms of diabetes, and of course, high blood pressures are the main contributing factor to have heart problem. Heart screening is something not to be fearful of because it's fairly non-invasive, low risk, but it gives you a wealth of information pertains to your heart condition. So what do we do in heart screening? We do something what we call an ECG. Basically, you will have a lot of wires hooked up on you on your chest and on your limbs, but it doesn't cause you any pain. It doesn't shock you in any way. You won't feel any slightest discomfort as well. So this is something, a very basic test to look at how our heart performs in terms of electrical functions and in terms of the blood supplies. What we go on a further step is we combine the ECG with a treadmill test. Basically, we're just going to put you on a treadmill. We're going to increase the steepness of the slope. We're going to increase the speed of the treadmill gradually. And at the same time, we're going to monitor your heart rate, monitor your ECGs, monitor the heart rhythm, and look at any subtle changes that may pinpoint to us there's something very wrong with the heart itself. This will be a stress test machine in real life. So basically, this is a treadmill test, very much similar to what you see in a gym. In Thomson here, we have a television which displays videos, sort of distract you so that you're not going to be worried, oh, am I running enough? I'm going to be tired and so forth. Sometimes some of our patients, we realize from the initial test of ECGs and of course a stress test, they have abnormality in heart rhythm. Then we will take a step further, we put you on a Holter monitoring. So Holter monitoring is something that is a very miniaturized ECG machine that we can put on you and allow you to go back home and carry on with your daily routines. During these 24 hours when you are hooked up on this Holter device, you are supposed to go on with your normal routine. So it allows us to monitor your heart rate when you are sleeping, when you're working, when you're driving, and when you're talking and socializing. This is something that allows us to monitor the heart rate. It tells me overall in 24 hours what is the total heart rate of yours, whether there's any abnormal heart rate, abnormal rhythm. It allows me to see the ECG patterns and the rhythms of it. And Holter monitoring allows me to look at very precisely at the electrical problems of the heart. So to look at the structure of the heart, we do something called an echocardiogram. So it allows us to see within the heart chamber and look at the structure of the heart, whether there's any heart failure, whether the heart is in motion, is there any problems in it, and to look at any structural abnormality. So using all these different heart screening tools, we will be able to sort of tell you whether you're at risk of developing cardiac arrest or even heart attack.